as we come together at this National Sickle Cell Summit, and we will be welcoming ma'am, and welcome to the National Sickle Cell Summit, ma'am. Please join us on stage for the inaugural address.
This event is an attempt to bring the much needed attention to one of India's most widespread and invisible health crisis, which is the sickle cell disease. So this is certainly an issue which deserves all the urgent attention. And the good thing, encouraging thing is that despite being a genetic disorder, sickle cell disease is preventable and it is manageable. Under the visionary leadership of our Prime Minister, Shri Narendra Modi ji, we launched a very bold and time-bound initiative, the National Sickle Cell Anemia Elimination Mission in 2023. And under this mission, we have decided to screen 7 crore individuals in the age group of 0 to 40 years across 17 different states. And I'm happy to say that we started this mission in 2023, where we're standing in 2025. Our target was 7 crore people. We've already completed the screening of 5.8 crore people in the country. 2 crore 54 lakh people have been distributed their sickle cell status cards. More than 2 lakh people have been identified with the disease, and more than 16 lakh people have been identified to be having the trait. The state of Chhattisgarh has conducted maximum screening in the span of 2 years. Highest number of patients have been found in the state of Odisha. So that is a cause of concern for us. But we are glad that the state governments are working very passionately towards National Sickle Cell Anemia Elimination Mission. Apart from screening, we are making sure that after screening and after the cards are distributed, the patients who are found to be diseased, they get quality care, they are put on treatment, and counseling becomes very important. Not just for patients, but also for their support groups, but also for social organizations. Creating awareness is very important because a large number of people in the country still don't know about the disease, for which we are rigorously training our frontline health workers in the states. For the union government and state government, we are working together to make sure that our ASHAs, ANMs, who are actually given the task of screening, they are rigorously trained and they are able to provide compassionate care in the remotest of areas. And there is mandatory screening which is being carried out at our primary healthcare facilities and the Ayushman Arogya Mandirs today. There are mobile health vans which are specially deployed in the tribal areas so that people have access to screening facilities. So all these efforts are being undertaken because we want to create a sickle cell disease-free India by 2047. So it is the civil society, it is the doctors, it is the patient advocates, it is media, it is policymakers. Everybody's effort becomes important because it is a collective goal. All that exercise is being carried out. I'm glad today this summit is being hosted and all of us have come together. I would like to acknowledge the contribution, the role that all of you are playing, and especially our sickle cell disease warriors. I also take this opportunity today to sincerely appreciate the effort that has been made by the Hindustan Times group. You are acting like a force multiplier in this mission. So today is an occasion for us to pledge that no child will suffer in silence because of a sickle cell disease. And I am convinced when all of us decide to march ahead with science in our mind and compassion in our heart, we will be able to create sickle cell anemia free India by 2047. And with this, I congratulate Hindustan Times Group once again, and I thank you all for your patience. Jai Hind.
At the moment, we are very happy that a very good program, probably the world best program on sickle cell is going on in India, thanks to our strong political will of Narendra Modi ji, who has made it possible.
Hydroxyurea is the only evidence-based treatment that we have easily available.
Kind of treatment which we are actually coming is focused towards that how we can reduce the burden, how we can really bring down the pain points at least the end of organ damage, right? And how we can really work with the fraternity in terms of bringing down the overall mortality which happens because of the sickle cell.
Novo Nordisk is committed to be part of the solution alongside other public and private partners to transform the lives of people living with sickle cell disease.
लिविंग विद सिकल सेल इज़ नॉट ईजी। साथ ही मैं गवर्नमेंट ऑफ इंडिया का बहुत बहुत धन्यवाद करना चाहूँगी सिकल सेल एलिमिनेशन मिशन लॉन्च करने के लिए। मुझे इतनी हिम्मत मिली कि मैं आज सिकल सेल वॉरियर्स का वॉइस बन के यहाँ पे प्रेजेंट हूँ, आप सबके सामने मैं यहाँ पे बैठी हुई हूँ, इसलिए आप सबका धन्यवाद और गवर्नमेंट ऑफ इंडिया का बहुत बहुत धन्यवाद। और मैं हमेशा कहती हूँ कि आई रिफ्यूज़ टू बी अ विक्टिम, इंस्टेड आई चोज टू बी अ वॉरियर।
मिनिस्ट्री ऑफ हेल्थ, मिनिस्ट्री ऑफ ट्राइबल अफेयर और मिनिस्ट्री ऑफ सोशल जस्टिस, क्योंकि सिकल सेल डिसीज़ को डिसेबिलिटी का दर्जा दे के उन्होंने उन्हें एक ऊपर लाने के लिए मौका दिया है। तो भारत सरकार की ये तीनों ही अंगों ने बहुत मदद की है और सारे स्टेक होल्डर्स, हमारे एक्सपर्ट डॉक्टर्स, हमारे सारे जितने भी एक्सपर्ट्स हैं, कोलैबोरेटिव एफर्ट है ये। और ये हम पिछले 5 वर्षों से कंटिन्यू, जब नेस्को को हमने फॉर्म किया 2020 के अर्ली में, तब से हमने सारे हमारे स्टेक होल्डर्स, डॉक्टर, एक्सपर्ट, उन लोगों के साथ मिलकर कई सेमिनार्स इस देश में नेशनल इंटरनेशनल हमने कोशिश की करने की। और उसके बाद धीरे धीरे जो सेंसिटिविटी हुई और पेशेंट्स के जो इनपुट्स अलग अलग राज्यों से आने लगे, तो उससे इस देश में जो सिकल सेल की भयावहता है, जो बढ़ती हुई जनसंख्या है जो लाखों में है, वो समझ में आई। और मैं फिर से धन्यवाद दूंगा माननीय प्रधानमंत्री जी का कि उन्होंने मिशन मोड में ला करके इस डिसीज़ को एक कहीं ना कहीं अंकुश लगाने का एक क्या बोलेंगे उसको, साहसी एक निर्णय लिया है, जो पूरे देश में ही नहीं पूरे विश्व में आज सिकल सेल, भारत का सिकल सेल एलिमिनेशन मिशन को एक सकारात्मक रूप से देखा जा रहा है। तो ये बहुत बड़ा बदलाव है।
There are more people are suffering from this disease who are not aware of their own genetic condition.
Correct. I would say awareness is success of this mission. The only way we can minimize stigma is by doing awareness.
हम लोग आज से अगर इसको हम लोग कोशिशें करें तो आने वाले समय में, जैसे हमारे यहाँ पीड़ितों ने जन्म लिया है, तो आने वाले समय में ऐसा हम समय देखेंगे कि सिकल सेल जैसी घातक बीमारी के साथ लोगों का जन्म ना हो और इस देश में एक अच्छे समाज का निर्माण हो।
Collaborate to achieve the mission. I think that's a very simple message. There's a lot of uncertainties. The population suffering is not easily solvable, not easily reachable. The problems they have is not solvable easily. Everyone has to come together. Everyone has to put their hands together. And I'm pretty sure if we talk to each other, share the best practices, bring innovation and treatment options to India, and also support and close the diagnosis and screening, it is pretty much achievable. So collaboration is the key word.
As we come together at this National Sickle Cell Summit, please welcome Shri Jawal Oramji, Honorable Minister of Tribal Affairs, the Government of India. And sir, please, would you please come and address us on this National Sickle Cell Summit 2025.
सिकल सेल एनीमिया को फाइट करने के लिए, इसको इरेडिकेट किया जाए, इसको पूरा ख़त्म किया जाए, इसके लिए हमारा जो टारगेट दिया गया है 2047, माननीय प्रधानमंत्री नरेंद्र मोदी जी ने 1 जुलाई 2023 को एक जनजाति बहुल जिला मध्य प्रदेश का शहडोल हम इसको लॉन्च किया.
We have to make the system such that people who are born with conditions that are chronic, they don't have to go on a war path. They also live their life to the fullest as the rest of us. We should all rally behind all the programs that Government of India has started, led by none other than the Prime Minister. So we should all rally behind this and make sure these people who are born with chronic conditions like sickle cell disease, they also live their life to the fullest.
Absolutely. We have to alleviate the problems of individuals with sickle cell disease, or we call them warriors, or we call them individuals, or we call them heroes. Awareness and understanding their needs and addressing these needs is very, very important. And today's program, I think all those key stakeholders have come together.
पेशेंट लोगों के साथ भी हम लोग एक्सपीरियंस शेयर किया. वो लोग बताया अपना कि मैं कैसे मेरे को तकलीफ होता था, क्या होता था, आज मैं कैसे ठीक हूँ, या मेरा इलाज कुछ हो चुका है. बाकी कुछ इलाज में चल रहे वो लोग भी अपना अनुभूति, अपना उसको शेयर किया. लास्ट में जो ट्रीट कर रहे हैं डॉक्टर्स, उनका भी मैंने सुना. सबसे इम्पोर्टेंट जो हम उनके बारे में ज़्यादा चर्चा नहीं करते हैं, लेकिन वो है आशा कर्मी, आंगनवाड़ी कर्मी जो डोर टू डोर जा रहा है और इसको चिन्हित कर रहा है, और इसके लिए वो लोग को जो टेस्टिंग कर रहा है, इसके बारे में हुआ डिस्कशन. और उनमें से भी 2-4 लोग अपना एक्सपीरियंस वो लोग आशा आंगनवाड़ी कर्मी ने बताया. ये जॉइंट प्रोग्राम है, भारत सरकार का, आपका हेल्थ मिनिस्ट्री का है और हमारा ट्राइबल अफेयर्स का है. एक्चुअल में ट्राइबल अफेयर्स को चुना गया इसलिए कि ट्राइबल में ये रोग ज़्यादा है, लेकिन ये रोग बाकी लोगों में भी है, ये सारे लोग नहीं जानते हैं. हमारा बहुत सारे कम्युनिटी हैं जो उड़ीसा के, जो कि नॉन ट्राइबल हैं, वो लोग ट्राइबल नहीं हैं, ओबीसी हैं. अगरिया कम्युनिटी एक है, एक आपका ओबीसी प्रधान कम्युनिटी हैं, ये लोग भी हैं. ये लोग में भी सिकल सेल एनीमिया जोरदार है.
We have completed about 2 years since the sickle cell elimination mission started. Jharkhand was quite new to it. Other states had taken the lead. Some states have already been in this field for 10-15 years. All the patients and the attendants, most of them used to get tested. After that, when we thought that we have to accelerate, we went to the Ayushman Arogya centers also. Then we organized camps. We focused on Anganwadi centers, primary schools, Kasturba Vidyalaya, and then EMRS, Eklavya model residential school that is run by the tribal ministry. And our focus was to catch the children, because sickle cell anemia is a disease of childhood. So we focused on catching the children, and these were the catchment areas: Anganwadi centers, primary schools, and then these all the tribal schools.
in 1 year, we have achieved 96 to 97% screening program. एक चीज़ जो कॉमन निकल करके सामने आई है, ट्राइबल्स आर वेरी शाई पीपल्स. वह लोग गांव से आकर के एक सिटी के मेडिकल कॉलेज में प्रॉपर ट्रीटमेंट प्राप्त करें और ले सकें, ऐसा बड़ा कम संभव होता है. हमें यदि उनमें कुछ चेंजेस लाने हैं और रियली में वहाँ पर कुछ ट्रीटमेंट करना है तो वी हैव टू गो देयर डोर स्टेप. हमें उनके डोर स्टेप पे फैसिलिटी प्रोवाइड करानी पड़ेगी, तब जाकर के हमें डिजायरेबल रिजल्ट जो है वो मिलेंगे.
5.79 करोड़ लोगों का जांच हो चुका है. 5.55 करोड़ लोगों का नेगेटिव पाए गए हैं. ये खुशी का बात है, नेगेटिव पाए गए. 16.38 लाख लोगों की पहचान वाहक, दे आर कैरियर, लक्षण, कैरियर है, लक्षण है उसमें. 2.1 लाख करोड़ का लोग को जो है ये बहुत सीरियस है. सिकल सेल में अच्छा काम हुआ है. माननीय प्रधानमंत्री जो डांट लिया है, एक टाइप का ठान लिया है कि हमको उन्मूलन करना पड़ेगा. मैं हिंदुस्तान टाइम्स को मैं धन्यवाद देता हूं.
I would like to mention that I feel proud as an Indian when everybody says that there is a National Sickle Cell Anemia mission which targets to eliminate this dreadful disease.